You asked how to manage motion during high-dose SBRT treatments. We're answering with a compression tip that uses a thermoplastic mask for sub-millimeter precision without sacrificing comfort. That was money!
So now we're going to demonstrate an SBRT setup with a thermoplastic compression. So breathe in for us, nice deep breath, out. Breathe in again for us. Out. So Scott's gonna hook his side in first there. We're always going left to right so we don't mess up the patient positioning. I'm gonna go here. Okay, so breathe in for us, out. In.
Perfect, we'll do one more. Yeah, that's money. All right, so
next thing we're going to introduce is a wet towel.
So right now we're kind of creating a shelf for her diaphragm. It's like supporting her diaphragm.
Okay.
Now one more time, and on your exhale, we're going to apply pressure.
Got it. Now we'll try to apply this pressure here.
So now we are applying pressure with this wet towel.
Feeling okay?
Two reasons why we use the wet towel. Number one, it's cold and wet, which helps speed up this drying process. Since we did roll the mask over a couple times, it does take time for that thick portion to dry. So this does speed that up. The other thing is a dry towel will tend to stick to the mask a little more. So that wet mask kind of allows you to easily remove it. Yep. So Justin and I are just applying a nice constant pressure kind of down and up towards her diaphragm.
Here you can tell having the towel cold and wet.
Yeah, it's already starting
really
to dry.
helped that to cure.
So even here, we're really in a good spot. Now, the mask is not cured enough to take it off, but we're probably good to discontinue this pressure that we're
How do you feel? Try taking a slight deep breath in. She can't really do it. Okay, that's good. Does it feel uncomfortable at all? Okay. That looks great.
Yep. Beautiful.